What I want to show you here is hyperkeratosis on the teat ends. You can kind of see there's a small one on there. What that's made from is actually there's keratin. It's up in that teat canal. This teat is sucked down into the liner on the milker. It actually forms the keratin, a little bacteria in there, and that becomes very tender, very sore as this cow is milked. What happens a lot of times when they get real severe is the cow will actually shut itself down from milking. You're going to leave about 5 to 10% of the milk in that udder because the cow just gets to the point where she's not going to withstand the pain of that hyperkeratosis on the teat end. So what our protocol would be, we have our Vetericyn teat spray. What we'd want to do is come up there and spray that teat end, get all 4 teat ends. And if I was going to be drying this cow off, what I'd want to do is I'd want to leave that on there for 30 seconds. I'd come in here with a towel, I'd actually wipe those teat ends, clear anything off. Now if I was going to insert a dry tube to dry that cow up, I'd go ahead and insert my tubes. I've given that 30 seconds to a minute to sit on there. Now, one of the things, after I've inserted that tube, the normal protocol would be to use a post dip, a 1% 10 or a barrier dip. When I have a cow that has hyperkeratosis like this, we actually have our umbilical, navel, and udder gel, which we can go ahead and spray on there. And you'll see how that will bead up on the end of those teats. That gives me full coverage on those teat ends, as you can see it on there. If I do this twice a day for say 3 days, what's happening here by getting that blood flow to that teat end, I can actually take this towel after a few days of application, work that teat end, and that keratosis, that keratin, will peel right off there. Now what I've been able to do is actually open that milk flow back up to that cow. Instead of that milk coming out as a spray, it's going to come back out in a stream, the way that all of these cows want to be milked. So it's not anything that's going to happen overnight. It's a matter of putting this on several times in a row, several days in a row. You know, these cows are getting milked twice a day. If we can do this for 2 or 3 days, hopefully we're going to alleviate some of that issue.